how important is physiotherapy?
Physiotherapy plays a vital role in assessing and in also aids in the diagnosis of different physical problems. It's just not limited to those who currently have injuries. It's also like when we do tasks every day, especially if we're doing it repetitively, it causes microtraumas. We call it microtraumas on muscle fibers. They develop functional limitations when they do daily tasks. So that's going to be a big problem in the long term.
So we try to kind of
all these tests.
I retired, I mean, obviously, but thankfully,
All right. It's a new Tuesday, and as promised, you have a new episode of Tell Me Why. With me in the studio is Christine Juatas, who is a physiotherapist at NeoHealth. Christine, how are you?
I'm good. Thank you for asking.
Christine, I love the topic that we're going to talk about today because there are so many misconceptions about physiotherapy, and I think a lot of people treat physiotherapy as a reactive measure rather than preventative. And that's something that we have learned more and more, like in life, that it's not practical, that you need to be doing physiotherapy as a regular, type of therapy. And we're just going to discuss everything. I mean, the Olympics just ended, so we're going to talk about, athlete health and Olympic athletes' health and the importance of physiotherapy in their usual routine. We're going to talk about injuries. We're going to talk about recovery. But before we get started, I want you to define what physiotherapy is.
Physiotherapy is a profession that is mainly concerned with human function, the human body, and then the physical potential the person may have. So in our field, we aid in the diagnosis and treatment of different physical problems associated with different systems of the body. So that's like musculoskeletal, neurological, cardiac, and respiratory systems.
Okay. How long have you been doing this, and what do you do now? Tell us a bit more about your experience, and do you specialize in anything specific?
I've been a physiotherapist in the Philippines for almost 6 years.
Okay.
And from my previous work, we mostly dealt with musculoskeletal and neurological conditions, as well as providing prosthetic training to amputees. And we also treated children with cerebral palsies, cognitive delays, and then, developmental delays and congenital deformities. So I currently work at NeoHealth, which is a home healthcare company. So aside from physiotherapy, we also provide other diverse range of services. So we have an amazing GP on call. So if you have any health concerns and consultations and prescriptions for IV therapy, she also does that. And we also have our midwife, who is knowledgeable in pre, post, and antenatal care. And also we have skilled nurses, healthcare assistants, and caregivers who provide elderly care, child care, and also we have licensed nurses who administer IV therapy.
So you were saying it's a home health service.
Yeah.
That means you go to the patients.
Yes.
Oh, that's amazing. Okay. And something like physiotherapy, I'm sure that's very effective because some people might have severe injuries that, movement is not as easy for them. So do you find that effective to go to the person's home and to treat them there?
Yes. I think especially if they don't have anyone, or the accessibility is a problem. And also if we treat them at their most convenient time. So sometimes they want the therapy after work. So for example, if you're in a clinic, you're just limited to this time range. So sometimes if you want the therapy after work, then we can arrange that.
Yeah. So, amazing. Okay. So diving into our topic, and I think it's one that we should address. How important is physiotherapy? Is it for the everyday person, or is it just for the people that are injured?
Physiotherapy plays a vital role in assessing and in also aids in the diagnosis of different physical problems. So it's just not limited to those who currently have injuries. It's also when we do tasks every day, especially if we're doing it repetitively, So it causes microtraumas. We call it microtraumas on muscle fibers, and that predisposes the person to have these injuries. So usually when they experience this, it may interfere with their sleep, their work. They develop functional limitations when they do daily tasks. So that's gonna be a big problem in the long term. Yes.
Might lead to like other health implications,
Yes.
basically.
Yeah.
Okay, so the everyday person should actually opt for physiotherapy.
Yes, if it's actually really bothersome for them. But also it's good that if, for example, you want to have an assessment, like you have something like a neck pain or low back pain that's been bothering you for quite some time. So as a physiotherapist, you're like a detective. You're trying to look for the root cause because usually, like if you're drinking medication for pain, it's just a temporary fix.
Right.
But if you're like have a full assessment of the underlying cause, so it's gonna give you long-term benefits.
As a physiotherapist, what are some of the common injuries that you've seen?
Before I treated those, especially with musculoskeletal injuries, such as knee osteoarthritis, low back pain, and also cervical pain.
So these are the most common
Yeah.
injuries that you see in people. Okay. What are the rarest?
The rarest I've treated was a pediatric case. It's called muscular dystrophies. So it's like there's a problem with the gene. So there's a gene mutation which causes abnormalities. So the protein that it kind of produces that's responsible for healthy muscles is not working well. So that causes loss of muscle mass and also weakness. And also there's wrist pain, Decker vein tenosynovitis. So that's, I think I only treated once
Okay.
with abdas, but in other countries it's more common.
Okay.
Yeah.
Wrist pain.
Yeah, wrist pain. It's like a swollen or inflamed tendon. In the
Interesting.
thumb. Yeah.
Very, very interesting. Okay, as a physiotherapist, though, how do you determine how many sessions a person needs?
It actually depends on the patient's case. So, for example, if he or she is still at a hospital, so they might need like daily physiotherapy sessions, and then once after their discharge, in acute like 3 sessions, and then once they get better, like 2 sessions in a week is okay. But the frequency usually depends on the person's goals and needs.
Okay. I want to actually build up on that. So let's say I've had an injury and I did do my physiotherapy and I finished all my sessions. Is it like a one-time fix, or is it something that I should keep doing so that I can avoid the recurrence of this injury?
I think it's something that you should like practice consistently because you already know what the triggers are. So we don't want it to happen again. And sometimes if you've had injuries before, so it kind of predisposes you to have that same injury after a while if you become deconditioned again. So it's better that you be consistent.
Right, right. Earlier you mentioned, how taking certain medications might just numb that pain or mask that the pain that you have from an injury, but it doesn't actually solve it. So does physiotherapy actually help you recover? Can physiotherapy help you recover from an injury fully?
It also depends on the type of injury because in some cases there are degenerative or progressive ones like arthritis. So what we can only do is to manage the symptoms and prevent it from worsening. So, and also to like prevent the need for surgeries. So usually that's the last option.
Okay. And what happens if someone neglects an injury and like doesn't do their physiotherapy sessions?
There are actually some cases like adhesive capsulitis or we call it frozen shoulders, joint stiffness on the shoulder. So it's kind of recovers on its own. But it might take a longer time, and some people who've had it, like they can't return to their full range. after they have it without any intervention. And also, if you have like Achilles tendinopathies or injuries, if you keep on overloading it without any intervention, it might cause the tendon to rupture, and then that would you need surgical intervention for that. And also arthritis, knee arthritis. If you don't have any intervention, it's gonna be painful after a while, and then it's gonna cause joint stiffness, and then you might need like knee replacements as a last resort.
Right.
If you can't tolerate the pain anymore.
And what causes recurring injuries? Like why is it that sometimes some injuries keep coming back, even if you're doing the physiotherapy?
One reason is like repetitive movements. So it causes microtrauma to muscle fibers. The second one is overtraining. So like you like run for an extra mile, and then your body feels ache and then pain, and then it causes muscle fatigue.
In addition to that, are there any like technological innovations or like solutions that physiotherapists use today to help Olympic athletes or just athletes or injured individuals?
One of the technological innovations would be shockwave therapy. So it's like a machine that sends like sound waves on an area, and then these sound waves sends mechanical signals towards the brain, and then the brain will perceive it as that area as injury. So it's gonna send more nutrients in that area. So it's like promoting tissue healing.
So can you name maybe like three steps that people can do either in the office or at home if they're working from home that they should do, to avoid the discomfort or the pain or injuries in the future? So like maybe like stretching your neck, getting up, keeping the computer. Like what are your top three, steps?
Usually, like for example, if you're like using a gadget, so the more that you look down, the more like weight your neck has.
Okay.
So it's gonna overwork your deep neck muscles here. So that's gonna cause pain. So the better option is to have it in eye level. So if you have a pillow, you can just have your elbows supported or your arm supported like this. And then if you're working at a computer, the monitor should also be at eye level. And then another thing is avoiding prolonged sitting. So as much as possible, you know your body better than anyone. So if you're feeling like a bit aching, so it's time to move or try to have like a few like a walk around the office or at home, and then try to do some stretches. And then the last one is make sure that the computer or the keyboard, if you're using it at the office, it's not too far from you. So it's best that your elbows are supported, and your back also has like a lumbar pillow if you have, so that your trunk wouldn't be slouched like that.
Amazing. That's great advice, honestly. And I think I don't do any of these things. I mean, as horrible as that sounds. And I think the major one that resonated with me, because I did have, severe neck pain last year, and I had to wear neck support, and I was on, very heavy medication to help me recover from it. It's because of the gadgets. It's because of looking down and straining those muscles and the vertebrae in your neck. And I think it's one that we neglect the most. We're always on our phones.
Yeah, always the long-term practices that's causing the pain.
Exactly. And it wasn't because it was done overnight. It wasn't like, oh, yesterday I did something. It was because of long periods of time of doing the wrong thing. Yeah. Christine, thank you so much for your time.